Hi, I'm Dr. Kavitha Bhat. I'm a pediatric endocrinologist at Aster Hospital. Today, I plan to share some information about a common condition seen in infants and toddlers called bow legs or genu varum. This is a condition wherein the legs are turned outwards at the knee and touching at the ankle and foot, giving the leg a bowed appearance. This is commonly seen in infants and toddlers and sometimes in older children too. In most instances, it's physiological, meaning it does not cause any problem and there is no underlying pathology happening. However, rarely it can represent a pathology or a disease condition. The physiological bow legs, which could be part of normal growing up, usually resolves by the time the child is 3 years old. If the bow legs is persisting or worsening, then we need to think of some other condition. These bow legs generally do not cause the infant and toddler any problem. It doesn't interfere with the crawling, walking, running of the toddler. However, parents may worry about the appearance of their child's legs or the awkward walking pattern. Now, what causes bow legs? As the fetus or the baby is growing in the mother's womb, it's a little cramped up space and the legs have to rotate inwards to accommodate for the reduced space in the mother's womb. And this is what persists for some time after birth as well. And when the child starts walking, it may become more apparent and seem more severe, only to get better by the time the child is 3 or 4 years old. Occasionally, this can represent a more serious problem of the bones. One of them is rickets. Rickets is a condition where bones get softer because of either lack of minerals, bone minerals like calcium and phosphorus, or lack of vitamin D, which is responsible for absorption of calcium from the intestine. This condition of rickets can be treated with replacement of the necessary minerals like calcium or phosphorus. The other condition usually seen in overweight babies is a condition called Blount's disease, which affects the growth plates at the level of the knee joint. And very rarely, injury or disease at the growth plates can also lead to bowing of the legs. So when do we need to see a doctor for this? If the bowing is asymmetrical, meaning the bowing is more on one side compared to the other side, or the bowing is associated with difficulty in walking, climbing, is associated with pain, then you do need to consult your doctor for that. Thank you.